What they do is they literally cut out a piece of your bone, fully removed it, reshaped it, shaped the bone around it. This is so gross, so graphic. I feel like I've been waiting for this moment for years now, and it's finally done. It's finally over. This surgery helped me so much. My facial dysphoria is gone. Hi guys, it is Samantha Lux. Welcome back to my channel. It's been, I think, a month since I've sat down in my studio and filmed a video for you guys. As you know, in the end of April of 2023 this year, I had my facial feminization surgery. So I was gonna do like a fun little like reveal moment, but I figured it'd be kind of hard to start this video without my face in it. So here's the reveal, ta-da, ta-da, ta-da. I'm so happy with it. I think it came out amazing. It's exactly what I wanted. I feel very, very grateful and very blessed to have had this surgery and, you know, to be so happy with the results. It feels really, really good. For today's video, I want to talk a little bit more about my experience with it. You guys have had a lot of questions over the last few weeks, you know, as I've been uploading the part 1 and the part 2 of my surgery vlogs. And so I wanted to sit down and answer your questions, talk about it, give you guys the official before and after, all that kind of stuff. So yeah, that's what we're gonna do today. Before we get started though, what do we think of the headband and the braid look? I kind of am obsessed with it. This is kind of just like how I did my hair for the surgery because obviously I didn't want to put product in my hair and I wanted to keep the incision clean and, you know, just away from anything that could contaminate it. And I think it looks so cute and feminine and cute and fun and fresh and cute. So I love it. I hope you love it too. And if not, shut the I'm just kidding. Also, if you guys have any cute little recommendations for fun or cute little headbands, let me know because I'm a headband girl now. Yep. Sure am. I post videos twice a week here on my channel, so if you guys are not yet subscribed, go ahead and do that right now. Go ahead. I'll wait for you. Thank you very much. And as I wait, I want to let you guys know that I'm officially going to start streaming very, very soon. The Legend of Zelda Tears of the Kingdom is officially out, and it is going to be the first game that I'm going to be streaming over on my Twitch channel, so get excited. Get freaking excited. I will admit that I have played it a little bit already. It's not going to be like a first impression stream or anything like that, but we can pretend if you want. I've also decided to create a YouTube channel where I'm going to be uploading a lot of gaming content. It's going to be a little bit of everything. I'll probably have highlights from my live streams over on that channel. I might do some unboxings, stuff like that, maybe some game reviews. We'll see how I feel. I just want to like, you know, dibble dabble in the gaming sphere, the gaming world, the gaming industry, whatever you call it. Oh my God, I forgot to close out the subscribe thing. Thank you very much. Thank you very much. But yeah, make sure to follow me over on Instagram, Twitter, TikTok, all those different places, as well as my Twitch channel to keep us up to date with me as possible and to make sure that you don't miss that first stream. I'm going to be announcing the first stream date very soon. My next video. Oh, and also I have a Patreon, so if you guys want to donate to my channel and help me, you know, make some of the money back that I lost and having surgery, that'd be great. Thank you so much. Not lost, spent. But okay, with no further ado, let's get into today's video. So there's a few different things, a few different questions, a few different topics that I want to touch on for today's video. The first of which is I really want to go into detail on the procedures that I had done. So of course in the part 1, you saw the pre-op, everything like that, but I really want to break down each of the procedures that I had. Technically, I had 3 different procedures, but they were all kind of like in the same spot, the same area, so they all kind of go together, but there were 3 separate procedures. The first one, and I say first one, not because it came first or like anything like that, but just because it's the first one that I'm gonna mention. So the first one in no particular order was the hairline feminization. So a lot of times with the hairline feminization, they are pulling the hairline down to, you know, create a smaller looking forehead. However, in my case, my forehead was already kind of short. So what they did for me was actually raise the center of my forehead to give it a more rounded and oval appearance. I love it. I am obsessed with it. I think it came out so good. And it's funny because I never thought to do this before I talked to Dr. Martirosyan. He's the one that actually recommended it to me, and I'm so glad that he did because I mean, I'm obsessed. But before I had surgery, when I was doing my makeup and stuff, I would always highlight and contour my face, obviously, but I would do it to feminize my face. And I would always put a lighter color right in the center of my forehead to try to draw the attention up to the center of my forehead. But I never even like connected the dots that like I should have a bigger forehead. I should have a taller forehead. But I do think it made a considerable difference in terms of, you know, the way that my gender is recognized for my face. A lot of people don't realize this, but females tend to have a taller forehead than males. Everybody just thinks that males have giant foreheads, and sometimes they do, you know, sometimes that hairline does need to be taken down, but a lot of times a female's forehead is taller. So keep that in mind, because if you shorten your forehead too much, it actually masculinizes your face. The second procedure, again, in no particular order, was a brow lift. When I had my pre-op and when I had my consultation with Dr. Martirosyan, Birdie said, shout out to Dr. Martirosian. When I had the pre-op and the consult, he told me that he actually really liked the placement of my eyebrows. He told me that he didn't want to lift them too much, and I actually agreed. I liked the placement of my eyebrows, but I did kind of want them a little bit raised, like a little higher, just, you know, to kind of snatch everything. So he was able to do that for me, and what he did was actually lifted the sides of my eyebrows, not like just all of it. He lifted more so, I'm like... So if my eyebrows were like this before, he lifted them so they're more like this, which has been amazing. It's been so feminizing. So I love it so much. You know how when you like pull your ears back, like when you pull your ears back with like your ear muscles or whatever, your eyebrows kind of go up and it's more of like a snatched look, and people do the whole thing like this to get snatched. That's just like what my eyebrows are like all the time. They're in that lifted, pulled back position even when I'm not pulling my ears back. See how the ends don't really move anymore? I love it. It's so good. It also helps with my eyeliner because now my eyeliner doesn't freaking fold over on itself. So yeah, that one has been really great as well. And again, I think it was very effective at feminizing my face, which I love. And now the last procedure, which was the most intense procedure, the most invasive procedure, and honestly, the reason that I went to Dr. Martirosian was the type 3 forehead reconstruction. Now this procedure is done mostly on trans women. It is done on some other people as well that just don't like their brow ridge, but it is done mostly on trans women to feminize the forehead. And in my opinion, it is one of the most effective feminizing procedures out there, like ever. So when you study the differences between males' faces and females' faces, especially males that have gone through puberty, you'll notice that males tend to have a ridge right here. They tend to have a bump right here that starts about here and then will bump out and end right at the top of their nose. So, I mean, it literally is like a bump here. What this does is it creates a lot of shadowing and it creates a lot of weight in your forehead, and it just looks very masculine. I do want to say that, of course, there's ranges to everything. You know, there are cis women with a brow ridge, there are cis women with low brows, there are cis women with low foreheads. But as a transgender woman, especially a trans woman who suffers from dysphoria, who has studied the differences between faces extensively, I really picked up on these traits and they bothered me a lot. So yeah, that's just to say, don't feel like you need to change your face if you're a cis woman with a brow ridge. You don't. That's not what I'm trying to say. I'm just saying for me, it was something that caused me a lot of dysphoria, a lot of discomfort, and made me feel like I looked like a boy. Like I felt like when I didn't have makeup on before, I felt like I just looked like a boy. Especially since I've kind of lost some of the fat on my body. My face has become a lot skinnier. You can see my bone structure a lot more. And I felt very uncomfortable with my face. Specifically, just like this portion of my face. Like down here, I felt like was always kind of good, but up here, I hated it. So yeah, for this type 3 procedure, what they have to do, it's really crazy because they can't just take like a burr, like a drill, and just like shave it down, because there's a sinus behind this bone, which is a giant cavity, you know what I mean? So if you shave down the bone too much, you'll break through the bone and, you know, there'll be a hole into that cavity in your skull. Not the vibe. Not the freaking vibe. So what they have to do for the type 3 forehead reconstruction is they make an incision from ear, right about here, all the way across to here, and then they elevate all of this skin off of the skull and kind of, this is so gross, so graphic, but they kind of flap it down so that the whole skull is revealed. From that point, they can shave down the sides of the burr because this bone is a lot thicker. They can also shave down the orbital rims because, again, it is solid bone. But in the center of the forehead, where that main protrusion typically is, what they do is they literally cut out a piece of your bone. For me, it was actually a very small piece of bone that they cut because I only had sinus on one half of my face, which is very weird, but we don't have to talk about that. What they had to do was literally take my skull apart. So they took a chunk of my skull out right here, pulled it out, fully removed it, reshaped it, shaped the bone around it, and then once they put it back farther into my head. So instead of having, it's so hard to explain. I'm trying to like think of a good way to explain it. So if this was like my forehead before, right? I had like this big bump. If they shaved the front of it, you would just have a hole. You know what I mean? You'd have a hole right through it. So what they had to do was take a piece of this wall out, reshape it, and then place it back so that it's like a flat wall again. I don't know. I'll try to find some animations or something online to demonstrate exactly what they did, but it was crazy. It was intense. Oh my God, he actually sent me operating room pictures, like from the inside of the operating room with my skull peeled down. Not my skull, my skin peeled down off my skull. It was crazy. I asked him to send them to me, so I fully signed up for it, but crazy, insane. Once they reshaped that bone, they reattach it right where they took it out, and they used a small titanium plate. It was probably like an inch and a half long, and about maybe 1/3 of a centimeter tall or wide, just like a little strip. They laid it right about here, and then put 3 screws, one on this side, and one on the piece of bone that they reattached. and that will stay there for the rest of my life. On top of the plate and on top of the screws and everything so that you wouldn't feel it, they did a bit of a bone paste, which I mean, if you're into sciencey stuff, if you're in healthcare or something, you may know, but basically they take bone filings and mix it with blood and maybe some other stuff, I don't really know. And they use it as like a paste or like almost like a clay, if you will. And they covered all that up and made it a really, really nice, round, smooth contour. And then that was pretty much it for the procedure. I know I say that was pretty much it, like no big deal, right? But that was the end of the 3 procedures. After that, they pulled my skin back up. Thank God they pulled it back up. He used dissolvable stitches on the deeper layers inside of my head. And then on the outside, he used surgical clips, staples, all the way across. I believe he used about 60 to 70 staples all the way across my freaking head. The staples didn't hurt or anything like that when I was healing. They were just really uncomfortable and like kind of scary because whenever I would touch my scalp, I would feel them and it would just like freak me out. But they didn't really hurt. I mean, sometimes I'd get like a little pinch, you know what I mean? Like a little short moment of pain, but it wasn't like excruciating pain or anything like that. I believe I took painkillers from about 7 to 9 days after surgery. The pain was not excruciating. It was not like immobilizing, anything like that, but it was very, very uncomfortable and it was pain. It felt like a combination of like a bad sinus headache, but then also the incision was just like aching. So yeah, I did take painkillers for that. But then after the painkillers, I took Tylenol and ibuprofen, like a little mixture for maybe like a week. And then after that, I was fine. I'm not taking anything now. So yeah, for my incision, like I said, it's way back here in my hair. I think it's literally here. So it's really, really far back, which is great. The incision, like I do have to say, it's not cute. Like I don't like it. I fully expected it to be, you know, a very intense scar, obviously, because I just said what they did, but it's understandable that it's an intense scar. But like some parts of it, like over here is a little bit raised where it almost feels like a little rope or something like that. You know what I mean? Like it's like a bit lifted, but then on other parts of my scalp, it's super flat and like you can barely see it. So I don't know what's going on with that, but maybe just the places that there was more tension, it's, you know, not healed as well, but I don't know. But either way, it's very, very well hidden in my hair. So it's really not that big of a deal for me. It was definitely worth doing the procedure. I do have a little bit of a bald spot right here though from the shock hair loss, which is alarming. It's scary. I know it's gonna grow back and everything like that, and I think some of the hairs were even cut when he made the incision, understandably, but it's scary to like have like a little bald spot the size of like a nickel. I don't like it. It's not cute. That's why I have a little headband on. That's why I've been brushing my hair over it so you can't really see it, but Dr. Martirosyan did encourage me to wait it out because he suspects that the hair will just grow back. However, if it doesn't, there is the option to do a hair transplant where they would take follicles from somewhere else on my scalp and then put them on the scar or on the little spot that's shedded. So yeah, not too worried about it. I'm giving it time. I'm trying not to stress. Oh my God, also I got my little ear pierced. I don't know if you can see it. It's just like a little tiny little pink stone. My ear is so red. I also changed this one out so it has a little diamond now. Okay, you guys, it is finally time. It is finally the point in the video where I want to show you the before and afters. Of course, you've been seeing the after this whole time, so I mean, you know what it's gonna look like, but I feel like seeing the before and after right next to each other is just so cool. Like, I love it too, so here we go. Let's put a few in. So these pictures, I hope you like my little bonnet. So not cute. I took these pictures the night before surgery, and I took the after pictures today, so. I also want to say that today is May 25th, so it has been exactly 4 weeks and 1 day since my surgery, and this is how we're looking. I feel like I'm, you know, pretty much fully recovered. I still do have a little bit of swelling up here, I feel like, and maybe a little bit like here, because I just feel a little bit of squishiness, but for the most part, it's really, really good. I mean, you guys saw how swollen I was right afterwards. It was intense, but thankfully it went away really, really quickly. As for like sensation and stuff like that, I feel everything. This is all good. Sometimes when I tap above my eyebrows, oh, it's so weird. I feel it like up here because of the eyebrow lift. I feel like they like pulled something up, so I can like when I tap here and here, I feel it up here, and I also feel it down here. It's kind of weird. But typically when this incision is made, when this procedure is done, there's a lot of numbness on the scalp. However, since he made his incision so far back, I really don't have much numbness at all. The only numbness that I feel is about 1.5 to 2 inches right here, right behind the incision. And it comes back right about here. And then I can feel all the way down here and all the way in front. So yeah, it's really just like this little strip that's numb. And that will probably come back within 6 to 12 months. But even if it doesn't, like it's fine. I don't care. So, oh my God. I do kind of care though, because sometimes my scalp will get itchy and I can't freaking scratch it. It's so weird. It's so weird. Like I'll feel an itch where it's numb, but then it doesn't register that I'm scratching it or something. I don't know how this works. I don't get it. But you know, what else did I have to tell you guys? In the second part of the vlog that I did, the healing from FFS part, you guys saw Dr. Martirosian take out some of my staples, but he left a bunch of them still in so that, you know, it would just be a little bit more secure while it finished healing. And it finally came to the time that I had to get the second set taken out. And I had the great idea, or my mom had the great idea, we had the great idea of taking them out ourselves. So we literally ordered like a little surgical staple remover, not like a regular staple remover, a surgical staple remover online. And we did it ourselves on my freaking birthday. I will say she did like this half, and then she hit one that was really, really, really painful. And I was like, give me that, you're done. It's my turn, I'll do it myself. So yeah, sorry mom, I know I was, you know, a little snippy, but that hurt. Also, one of them got like stuck. I don't know what happened. I think that it was like swollen around it, so I couldn't get it all the way underneath. I don't know, it just got stuck. It was really weird. I was literally sitting there like trying to like wiggle it out, like pulling at a staple on my scalp, like please get out of my head. It was not good, but it got out. My mom got it out, thanks Mumsy. But yeah, you guys, I'm trying to think if there's anything else that I wanted to mention. I'll probably think of it as soon as I turn the camera off, but yeah. I feel so blessed to have had this surgery. I feel so grateful. I feel so euphoric and happy. I've been feeling really, really good lately. Like my face finally feels like me. I'm finally feeling content with the way that my face looks. I just feel really, really good. A lot of times with gender affirming procedures, people will be like, oh, you don't need that. You're just obsessing and it's just gonna be something else once you do this and there's nothing wrong with you. You're just obsessed with your image, blah, 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 blah. But I have to say, like, that's not true. This surgery helped me so much. My facial dysphoria is gone. Yes, I do feel prettier and stuff, but I also feel safer. I feel like I can finally just like exist in the world without having to be aware of who's looking at me, what the lighting is like on me, you know, determining whether or not I'm in danger. I mean, of course, being a woman, I still have to think about that all the time, but now I don't have to worry about my face putting me in danger. You know what I'm saying? I don't have to shy away from doing things or going places because of how the light's gonna hit my face and how I'm going to look, and because I'm worried that I'm gonna get clocked and outed. It's been such a freeing experience. I wanna say thank you to my mom, Miss Mumsy. She helped me so much throughout this whole entire process, you know, from getting insurance coverage to organizing the whole trip to taking care of me afterwards and making sure that I was okay and all that stuff. She has been amazing. I mean, you guys have seen my mom. You've seen her in the last few videos. She has just been incredible. Also, my dad joined us for this surgery, for the recovery, and that meant a lot to me as well. In the beginning of my transition, going through these medical procedures was really, really hard for my dad to see. And I think that's just part of being a parent, you know? But it was especially hard for him. So he wasn't really comfortable going and being there for the surgeries. Of course, he gave me his support and he checked in on me, helped take care of me and stuff once I got home, but he wasn't there at the hospital and there in the hotel room afterwards, but this time he was. And he like made it a point to be there, which was very, really, really nice. But yeah, you guys, that is pretty much the conclusion. That's it. I feel like I've been waiting for this moment for years now and it's finally done. It's finally over. And then people always say to like worry about like post-surgery blues and stuff, and I did have a little bit of that when I was looking really scary, but I just feel so good now. Like I feel so great. Thank you so much for all of your support and for the kind words and everything like that. It's definitely meant a lot to me and it's helped get me through the difficult healing process. I am very, very grateful for all of you. But yeah, you guys, I think that's about it for this video. If you have any other questions, make sure to put them in the comments. I will do my best to respond to them, or maybe if you guys have the answers, you can respond to each other. Make sure to subscribe if you want to and you are not already. Give this video a big thumbs up. Send it to your favorite trans friend that maybe is having surgery. And yeah, other than that, I think I'm gonna go. So thank you all so much for watching. Thank you for being here for me throughout this whole process. And I'll see you in a couple days. Bye, everyone.